Hi and welcome. I'm John Catch, Director of Member Services for Empowering Benefits. Today I'm going to walk you through Health Excellence Plus, a unique and different way to manage your health and medical expenses. If you've been to our website or spoken to one of our affiliates, you probably recognize that this is unlike the traditional health insurance that you might be used to. So it might take a bit of a paradigm shift, a new way of looking at something you're already familiar with to get a feel and an understanding for it. So as we go through the presentation, jot down any questions you have, and we'll address them at the end of the meeting. You'll also notice there are handouts depending on the platform you're viewing this on. The go-to-meeting panel on the right will have 4 handouts. We welcome you to download those. They'll give you some clarity based on the information that we're sharing today. No mystery, the world of healthcare is a mess. It's getting prohibitively expensive, and no one knows if it's truly fixable or not. Now, the picture on the screen would be funny if it weren't so true, but there's more and more interference coming from insurance companies and the government stepping between you and your doctor. We're suggesting that you can step out of that existing paradigm, that maze and that bureaucracy, by adopting a strategy rather than looking for a new or better health insurance plan. A unified strategy that's going to manage all of your health, wellness, and medical expenses. If you're familiar with health insurance, you know that it comes in 2 flavors, either a group plan offered typically by employers or as an individual plan. Historically, group plans tend to be less expensive and more efficient because they're the flexibility in the way they're allowed to be structured. Health Excellence Plus is the group platform of empowering benefits which you can qualify to join. Now, I have to preface this is not a perfect solution for everyone. If there were a perfect solution, we'd already see it, but that's just not the case. 3 things you have to ask yourself. In the last 36 months, have you been diagnosed with, been treated for, or shown symptoms of any condition? That's important because that would be determined to be a pre-existing condition. No expenses in the first year would be eligible for sharing, up to $25,000 in the second year, $50,000 in the third year. The 4th year and beyond, there is no longer a pre-existing condition. Now, depending on the condition you have, the treatment needs and the costs associated, we have to weigh whether or not this is right for you. Secondly, do you take expensive maintenance medications? You're dealing with an ongoing condition that requires you take ongoing medications. Depending on their expense, might or might not be a good fit. We have a very strong World Meds agreement that allows us to save huge amounts of money in prescription meds. So it's a matter of looking at the cost and weighing whether or not this is a good fit. Thirdly, do you get a subsidy from the government to pay for your health insurance? If you get a large subsidy, this might not be a good fit. At any rate, numbers on the screen, feel free to call one of our representatives. They'll be able to walk you through the process and help you make that decision. We'll also be available at the end of the presentation for a Q&A. So I mentioned a strategy. A cohesive strategy. And if you take a look at the screen, you'll notice, like building blocks, it starts with a foundation of avoidance. You want to get and stay well. We help you do that. Secondly, you want to utilize the preventative care that's available as mandated by the ACA that covers 64 screenings and so forth that we'll go over. Thirdly, you want to manage those health expenses when they come due in a logical fashion. There's always going to be a certain amount of money that you have to spend out of your pocket. But there are certain things you can do to really manage that in an intelligent fashion. You want to mitigate those expenses when they come due, using technology that we provide for you. And lastly, you want to contain those medical expenses to a level that is comfortable for you and your family through medical cost sharing. Now, the lower 3 components are really proactive in nature. You have to be involved. We'll go through the avoidance section, the preventative section, and the management section, but those are things that you really need to put in place before you get ill or before you get hurt. Reactive components are up top. When that other shoe drops, something happens, you want to reduce the cost as much as possible and provide a financial backstop through cost containment with medical cost sharing. So if we start at the bottom, that foundation or lowest component is avoidance. Now, obviously, if you can get and stay well, you avoid getting sick. If you don't get sick, you don't incur medical expenses. Currently, 86 cents on every healthcare dollar in this country is spent on managing chronic conditions. So our objective is to help you stave off the onset or avoid them altogether, those chronic conditions that eat up so much of our healthcare dollars. And this is what that looks like. On the right, you'll see a health risk assessment. This is a requirement. This is personal and confidential. It doesn't get shared with anyone. It's designed for you to get a sense of where you are, what's your current state of health and wellness, to help you develop goals and to help you achieve them. The 6-page report lists out all of your potential health risks based on your family and personal history and so forth. It gives you the educational component and the actionable steps you can take to mitigate those risks. On the left is a screenshot of the wellness platform that we utilize that helps you engage, set goals, track your progress, and achieve them. Again, a very strong interactive learning component. Keep you engaged and keep you focused. The other section that goes hand in hand with avoidance is prevention. Now, some of us genetically are predisposed to developing certain conditions at some point in our life. But if we utilize preventative care as mandated by the ACA, we utilize a minimal essential coverage or MEC program. Ours is actually a MEC Plus. It covers all 64 preventative services, including annual physicals, mammograms, colonoscopies. No cost to you, no out-of-pocket expense, no co-insurance, no deductible. The reason this is so important is that if you can identify potential medical issues before they become medical problems, they're easier and much less expensive to deal with. Now, we know that that rainy day will come, so the objective is to put some money aside in a way that's both tax advantaged and logical. So you choose the level of financial exposure that's comfortable for you and your family. And you want to be able to set monies aside to pay for those expenses when they come due. Utilizing a health savings account, which we're qualified for because of the structure of our MEC Plus, allows you to put as an individual up to $3,400 a year, as a couple $6,000 a year, into a pre-tax account. In other words, that money is tax deductible dollar for dollar. It can be a huge savings depending on your tax bracket. But additionally, if you look at it, if you use this as a pass-through, you put money in to save, and when you spend it, you're effectively achieving a discount on those services and products equal to the tax bracket you're in. Logical and intelligent. Additionally, that money rolls over year after year. It's not use it or lose it. At the age of 65, if money is accumulated in that account, it becomes a jumbo IRA. You can spend it for any purpose you choose. So this is a smart way of protecting yourself, putting a little money aside for that rainy day, which I'm sure will occur. We talked about, that when that other shoe drops and we have an incident that, causes us to become either injured or ill, and you're going to incur medical expenses. We provide you with technology that will mitigate those expenses, reduce them as much as possible, 24/7 telemedicine. You can speak to a board-certified physician 24/7, do a consult over the phone, preliminary diagnosis, tell you if you actually need to be seen. They'll also prescribe medications over the phone. That's at no cost to you. There's an advocacy program that helps you shop for medical services. One case, we had a member that needed a hip MRI. We were able to find 5 facilities within a 10-mile radius, and the prices range from $399 to $1,825. A huge spread, and they don't advertise prices. So to mitigate your expenses when they come due, utilize the advocacy program. Lastly, you can't always avoid and prevent getting sick, and as much as you save for a rainy day, there's likely come a time when you'll have medical costs that create a need for those costs to be shared. We do that through a cost-sharing strategy, medical cost sharing, where a community of like-minded, health-focused individuals come together and they share expenses above and beyond the amount that they've chosen as a comfort level for them and their family. Think of it like an Amish barn raising. If you're familiar with it, in the Amish farming community, they don't insure their barns. If one family loses a barn due to fire, the community comes together and they build a new barn. Similarly, in this health sharing community, when you pierce that level of personal responsibility and personal comfort, that amount of out-of-pocket you'll spend, that sharing community comes together and pays 100% of those additional costs. So there's a couple of things that you'll need to understand in wrapping your head around this. First is understanding a need. A need is an incident or an occurrence that causes you to spend more money than you have chosen as your personal exposure or your personal risk. Secondly, you need to understand that because this is a group benefits plan, you have to develop a relationship with MPowering Benefits. And we'll show you how to do that. Think of it this way. In the real world, you are effectively a self-pay patient that has a backup plan or a financial backstop. And if you think about it, doctors and facilities prefer to have a cash payment. They don't have to wait 90 or 120 days for the insurance company to pay. They don't have to jump through hoops. They don't have to go through the bureaucracy and fill out the paperwork. So most of them are more than willing to give you a significant discount for paying cash. Remember that health savings account, that money you put aside for a rainy day. You choose what we call an initial unshared amount. That initial unshared amount can be likened to a deductible. In this case, it would be more like a deductible in automobile or homeowners insurance. And the way it works, you choose as an individual either $500 or $1,000 as the initial unshared amount, that financial exposure you have. When you have an event, an injury or an illness that occurs that causes you to pierce that level of $500 or $1,000, the medical cost sharing community comes together and pays 100% of everything else. And to further limit your financial exposure, if you should be unfortunate to have that happen 3 times in 1 year, that is all the initial unshared amount you are liable for. As an individual, those first 3 events, and beyond that, the health sharing community pays 100% of everything else. This is sometimes maybe a little bit difficult to understand, but again, spend some time viewing the materials as explained on the site, and we'll give you a real-life example of how this works. I'm going to give you the tale of 2 families. The family on the left has chosen health insurance. The family on the right has chosen MPowering Benefits, Health Excellence Plus. Now they have a mother and a father and a child. The child has persistent ear infections. They have, again on the left, they have an insurance plan with a $2,500 per family member deductible. Very common story. They have a 1-year-old child who has persistent earaches. The first office visit, the second office visit, prescriptions, injections, there's treatment going on. Finally, the doctor says, I got to refer you to a specialist. In all those instances, you pay a co-payment plus a little bit of co-insurance for either the prescription or the injection. See, in the world of health insurance companies pay a majority of the small items. But when it comes to a larger item like the surgery, that becomes subject to the deductible. In this instance, their total amount of out-of-pocket cost was $2,275. Utilizing the MPowering Benefits Health Excellence Plus program, the family on the right paid for the office visit, the first office visit. They paid for the second office visit and the prescriptions. They paid for likely for the third and perhaps the fourth visit. But once they've hit that level, pierced that level of $500, which is the exposure that they've chosen, the medical cost sharing community steps in and pays everything else. I'll go you one better. Let's say that this child's treatment lasted for 18 months, and then the tubes fell out. They had to be reimplanted 20 months later. Because that relates to the same need, that same initial condition, their total financial exposure, regardless of how long it took for those symptoms to resolve, was $500. In this instance, it's a huge savings. Couple that with the cost per month differential, and it is a financial game changer for everyone. And we talked a little bit about the relationship that needs to exist between you and Empowering Benefits. Empowering Benefits Health Excellence Plus is compliant with the ACA employer mandate. And in order to enroll in the Health Excellence Plus group plan, you must agree to become an independent contractor of Empowering Benefits. Now, we're not asking you to come to work for us. We do two simple things. First, that personal risk assessment that we told you about earlier, you need to complete that. And in doing so, it's private, confidential, shares with no one. We don't even see it. That can, again, we compensate you $25 for that, which allows us to provide you with a 1099 miscellaneous at the end of the year, satisfying the requirement. Additionally, refer at least one member a year who enrolls for 2 months or more. Now, we're not asking you to come to work for us, and this is not as frightening as it sounds. 90% of the individuals who have enrolled in our health sharing program have referred friends and family or coworkers. See, this is a grassroots movement. This is not advertising. This is not buying television time. This is members telling members, spreading the word in a grassroots fashion, and for that, you get compensated. So again, any questions that you have regarding how this all comes together and works, we encourage you to call 844-403-2112. Talking about pricing, remember that financial exposure you choose is a level of $500 or $1,000 individual or initial unshared amount. And then the prices graduate from an individual member, depending on their 30 or over or under 30, a member and a spouse, member and children, or a family membership. Again, these prices are posted on the website. There is an initial $150 initial membership fee. So that is Health Excellence Plus, a new and different strategy for managing your health, wellness, and any of its associated costs. We welcome you to join the movement to take back control of our own health care and visit us at healthexcellenceplus.com. I'm going to open up the floor for any questions that you might have, and I'll unmute you in just a moment. If you jotted down any questions, now's the time to ask them. If you don't have the opportunity to ask, or if you don't have the opportunity to download the handouts that are available, again, give us a call, let us know, and our affiliates will be more than happy to assist you.